Alrighty, well, good afternoon, everyone, and welcome to this informational webinar on Social Security retirement benefits, which is hosted by U.S. Senator Bob Casey's office and the Social Security Administration. We're grateful for everyone taking the time to join this call today. I want to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. I'm joined by my colleague, Maria Hernandez, and from Social Security Administration, we're excited to introduce Jessica Sylvant. We're grateful for her willingness to join our office for today's webinar. And at this time, I'm going to turn the call over to Jessica to delve more into the specifics.
Thank you so much, Andrea. Good afternoon, everyone. I would like to thank you for joining me for today's call. I'm going to be covering many benefit programs that Social Security offers to the public, including retirement, spousal, survivor, Medicare, and disability benefits, as well as an overview of our online services and tools available on our website that people can use to help plan for their financial future. And I'm going to be covering a lot of information today, but there will be time after the presentation for questions. And I am keeping my camera off just for the time being to help preserve the bandwidth should more people join as we go forward here. Next slide, please. So in addition to our benefit programs, I'm also going to discuss your work and how paying into Social Security tax can help you become insured for benefits. I'm also going to talk about electing your benefits. So when is the best time? When is the earliest that you can file? The reduction that comes with taking your benefits early and the advantages as well. Additionally, I'll talk about working while receiving your benefits, how much you can earn if you're still employed when you begin to collect. We're also going to talk about family benefits, including benefits that are payable to a spouse, a minor child, also to survivors. And finally, Medicare, which is a federal health insurance program, and what exactly Social Security's role is in helping you to enroll when the time comes for Medicare. And as I just mentioned, I will also touch upon some of our online services and some of the most popular features that are helpful to someone who is preparing for retirement. Next slide, please. So a few things that are new in 2024, and I do realize we're about 7 months into the year at this point, but there was a 3.2% cost of living increase, which was effective January of this year. That applied to all current SSA recipients, as well as to people who are not yet receiving a benefit, but were age 62 at some point in 2023. So they will also see the 3.2% increase in their benefit when they begin to collect, regardless of how far in the future that may be. I also like to include the average benefit amount because that's just a question that I receive pretty frequently. The average retirement amount a beneficiary will receive in this year comes in at $1,907 per month. There was also an increase in the monthly Medicare Part B premium that went up to $174.70 for this year. And there were also increases in the allowable earnings limit for recipients who were under their full retirement age and collecting a benefit. And I will get into those specific limits very shortly as we go along. Next slide, please. So Social Security has 4 main programs that are funded by the Retirement, Survivor, and Health Insurance Trust Fund. The first, of course, being retirement, which is a monthly benefit that is payable to individuals who are a minimum age of 62 and have enough quarters paid into Social Security to be insured. And secondly, we pay survivor benefits to individuals who have been predeceased by a spouse or a minor child who had a parent who worked enough in their lifetime to qualify for benefits. Additionally, we have a disability program for individuals who have either a physical or mental impairment. They expect to prevent them from being able to work for 12 months or longer. So it is considered more of a long-term disability program. And you'll see the SSDI and SSI in parentheses. We have 2 disability programs. The Social Security Disability Insurance Program is based on someone's work and earnings, where their monthly payment is derived from their most recent earnings history. And the SSI program, also known as Supplemental Security Income, is more of a federal welfare program for disabled individuals who have limited income and resources, and there's no work requirement for that program. And then finally, there is Medicare. Again, that is the federal health insurance program. Through Social Security, we help you to enroll for Part A and Part B, and I will be discussing the various enrollment periods and eligibility factors. Next slide. So just how much work does someone need to qualify for retirement benefits? When a person works and pays into the FICA tax, which is the Social Security tax, or you may see it also come up as OASDI on your pay stub, you earn credit. So for this year, 1/4 of coverage or credit is $1,730 in earnings. And you can earn up to a maximum of 4 credits per year. And you must have at least 40 credits or a minimum of 10 years of work to be insured for retirement benefits. So the minimum that an individual could earn and still receive the maximum of 4 credits earned for the year is $6,920. Now, of course, the more money you earn, the more FICA tax you're going to be paying. So as a result, the higher your monthly benefit will be. And then additionally, there is an age requirement. So you have to be at least age 62 to be eligible, and you have to be 62 throughout the entire month to be eligible. So let's say you're turning 62 today on July 17th. You would have to wait until August to file for your benefit, as you have to be 62 throughout the entire month to be eligible. Next slide. So Social Security uses a very complex formula in determining your benefit amount. However, I'm going to simplify it into 3 basic steps. So step 1 is we adjust your earnings for changes in wage levels over time. So essentially, we look at what you earned years ago. So whether you begin working in the 70s, 80s, or 90s, or even later than that, we will index it for inflation and adjust those earnings for what it would be in today's dollar. Next, we find the monthly average of your 35 highest years of earnings. Don't worry if you don't have 35 years, as long as you still meet that 10-year work requirement, that minimum work requirement, you'll still be eligible for a benefit. However, if you don't have 35, we may have to use years of 0 earnings when figuring the calculation of your amount. And then finally, we take that result to find the average indexed monthly earnings, and that's where we incorporate the number of months figured into the equation to arrive at the final average benefit amount. Next slide. So one of the most frequently asked questions I receive is, when is the best time to start receiving my benefit? And this is a very personal decision. There's really no right or wrong answer. It really depends on your circumstances. Everyone's situation varies. But as you can see on this chart, the longer you wait to file, the higher the benefit you receive. Now, this specific example on this slide is based on a $1,000 monthly benefit amount at the person's full retirement age, which is the age you receive an unreduced benefit. And then it shows what the varying amounts would be if that individual were to elect as early as possible at age 62 versus deferring all the way to age 70. That's another filing option that I'm going to get into as we go along here. But you can see, the incremental increases by waiting until your full retirement age and beyond there, and also the reduction that comes with taking your benefit at age 62. Next slide. Now, your full retirement age, or FRA, as we refer to it, and I'll be referring to it as FRA throughout the presentation today, is the age when someone receives their full unreduced Social Security benefit amount, and that age is determined by your year of birth. So as the years progress and people have been trending to live longer lives, the full retirement age has slowly risen in conjunction with that. So for anyone on this call today who was born in 1960 or later, your FRA is age 67. Now, if you elect to receive a reduced benefit prior to your FRA, you can see what the percentage of the reduction would be. So if your FRA is 67 and you elect a benefit at 62, you're going to see a reduction of 30%. or on the example on this slide here is someone who has a FRA amount of $1,000, taking it at 62, taking that 30% reduction is going to reduce their benefit to $700 at 62. Next slide. And here's just another example of what a reduced benefit would look like in comparison to waiting until FRA. So in this case, again, we're looking at a 30% reduction in the benefit amount because this person's FRA is age 67. So their benefit would be reduced should they wait till their FRA at 67, they're looking at a reduction from $2,500 at FRA to $1,750, taking it 5 years earlier at 62. Next slide. Now, when you elect to receive a retirement benefit prior to your FRA, you are subject to an earnings limit. So if you're still working and thinking about collecting and filing for a reduced benefit, you are subject to an annual limit. For this year, anyone under their FRA for the entire year, that limit is $22,320. And we look at the calendar year, January to December. Now, when you do go to file, if you're under your FRA, you're still working, we'll ask you how much do you expect to earn for the year? And we do withhold $1 back for every $2 over that limit you should exceed. So we'll ask you for an estimate up front, and then if we have to withhold a portion of your money, we do that up front to help prevent any type of an overpayment from occurring. Now that limit does increase pretty drastically for anyone who is filing for benefit in the year they reach their FRA. So that limit's $59,520 from January up until the month before they reach their FRA. So to give an example for that, let's say somebody turns FRA next month in August, and they contacted us, let's say in March, and they wanted to file for their benefit. They didn't want to wait until August for their FRA to file. That means that they can earn up to $59,520 between January through the end of July and collect that benefit beginning with March, as long as we only looked at the first 7 months of the year. So if they're going to be under that limit for the first 7 months, they can receive their benefit without anything withheld for their work and their earnings. Should they exceed that limit, we then withhold $1 back for every $3 over that $59,520 earnings limit that they go. And then once you hit the month of your FRA, there's no cap or limit to your earnings, so you can make as much money as you'd like. It has no impact on your eligibility to receive your Social Security benefits. Next slide, please. Now, there's also an alternative earnings limit that someone can apply under. It's called the monthly earnings test. And that's where we will consider your work activity on a monthly basis if it is more advantageous. So this provision generally applies to people who have worked for a portion of the year and they stop midway or maybe closer towards the end of the year. So if you exceed the annual earnings limit but don't plan to return to work for the remainder of the year, you can apply under the monthly rule where you can receive your retirement benefit as long as you're earning less than $1,860 per month. When you're in the year of FRA, that limit does go up to $4,960 per month. And I have an example on the next slide, the monthly rule. So we have Bob, who's 63 years old, and he earned $70,000 from January to October and retired on November 1st. Now, Bob can receive his full benefits for the month of November and December as long as he doesn't return to work and earn over $1,860 in either of those months. So we basically disregard the fact that he earned way over the annual earnings limit. He earned $70,000 until he retired. So we only look at his earnings going forward from November 1st, going forward for the remainder of the year. Next slide. So another filing option that is available is to defer your benefit beyond your FRA, in which case you would earn what are called delayed retirement credits. Retirement benefits are increased by a certain percentage for each month that you delay starting your benefit beyond FRA. It amounts to about 8% per year overall. The increase does stop after age 70, so there is no advantage to waiting beyond that point to file. And that additional, the delayed retirement increase is also passed on to any surviving spouse or surviving child who may become eligible on that worker's record down the road. So that's another good thing to know about the delayed retirement credits. And on the next slide, I have an example of how deferring and receiving delayed retirement credits impact someone's benefit amount. So this is using the same example, someone who has a FRA of age 67, their benefit at their FRA is $2,500, waiting those additional 3 years at an 8% increase over that 3-year period is going to boost their benefit up by about 24%, or in this example, from $2,500 to $3,100 at age 70. Next slide. Now, in certain situations, we can pay retroactive benefits. Generally, it's only to individuals who are filing after their FRA, in which they can elect payments up to 6 months retroactively. So, for example, for someone who reached their FRA, let's say last December, should they file for retirement benefits before the end of June, they can elect payments back to December. So as long as they contacted us in June, we protect them with that date, whether they called to make an appointment or they started their application online, we can go back 6 months from that filing date. And that money is paid to the person in one lump sum. However, someone who has not yet reached their FRA can only elect payments beginning with the month they contacted us to make an appointment or started their application online. So there's not as much, there aren't as many options available for paying benefits retroactively, generally speaking, unless someone is beyond their FRA. Next slide. So the big question a lot of people ask is, when should I take my benefits? And again, this is a personal decision. It comes with a lot of factors to consider. Longevity, that's a big one. People are living longer than ever before. In fact, 1 in every 3 people who are age 65 right now will live into their 90s. So waiting to collect to maximize the benefit amount may be appealing, as the benefit will be crucial in helping someone sustain a hopefully very long period of retirement. But at the same time, none of us has a crystal ball. Some of us may not be as fortunate to make it to our 90s. So we do see a lot of people who choose to take their benefits as early as possible because you don't know what tomorrow will bring. And a lot of people opt to take the money while they can use it and enjoy it, or even invest with it. Another major factor is your work plan. So do you enjoy working? Do you plan to continue working for a bit longer? How much money are you earning? You might be able to continue working and still receive a portion of your payments depending on your income. And remember, once you reach your FRA, even if you're still employed full-time, you can receive your Social Security benefits regardless of how much you are earning. Finances, do you have enough savings and resources to live comfortably to sustain you through your retirement? And taxation, that's a major one to consider. A lot of people that we talk to are concerned about the tax implications of receiving their benefits, especially while they're still working. And I am not a tax expert, but what I can tell you is that we do send you a 1099 for tax filing purposes at the end of each year to show that you were paid in Social Security benefits. And there is an option to voluntarily elect to have federal taxes withheld from benefits by submitting a W-4B form, which can also be submitted online now. Next slide. So payments are always made a month behind. We used to pay benefits all on the same day at the beginning of the month, but that proved to be too much for the Postal Service and for banks. So we now stagger them based on the date of the month they were born in. So those who were born between the 1st and the 10th receive their payment on the 2nd Wednesday of each month. Those born between the 11th and 20th receive their payments on the 3rd Wednesday. And those born between the 21st and 31st receive their payments on the 4th Wednesday. and the payments are made a month behind, that is because you have to live throughout the entire month to be eligible for the payment. So it's good to know that information because, sometimes people will contact their agency and file and think that they're going to be receiving their first payment immediately. Sometimes you have to plan that there's going to be a little bit of a gap from the time that you file or the month that you elect your benefits to begin until you receive that payment, especially if you're born later in the month at times, because your payment's going to be coming. Let's say if you're electing, you want your payments to start effective with September, that maybe aligns with a upcoming retirement date, and you're born towards the end of the month, you're not actually going to receive that payment for September until the fourth Wednesday in October. So it's good to know, just to plan that there could be a little bit of a lapse there in between receiving that actual first payment. Next slide, please. So there's several ways to apply for benefits. The easiest and most efficient way is by doing so online at our website, ssa.gov. You must have a My Social Security account to file online. It's really the optimal way to file because you can do it from the convenience of your home. You can do it at your own pace. You can start and stop the application as needed if you can't complete it all at once and return to it at a later time. However, if you do prefer to speak with a representative, you can call our toll-free number on the screen. That's our 1-800 number to make an appointment with your local field office. And you can file up to 3 months in advance. So if you know ahead of time when you want your payments to begin, you do have plenty of time to file ahead of that date if you wish to do so. And just a quick thing I want to note, whether you apply online or over the phone, if you're speaking with the representative, all the questions, all the information that we gather is the same. It's the same application. Next slide, please. Okay, now this is a screenshot of the homepage of our website. This is where you would go to access the online application, that big apply button right in the middle. And you have the option of applying just for your benefits. You can apply for Medicare only or for both if that is applicable to you. And then to the left of that, you'll see the Prepare section. That's where you can check your eligibility for benefits, and you can access a plethora of online calculators to help provide you with an accurate estimate of your future benefits. So there's a lot of great retirement planning tools available online on our website. Okay, so I am going to talk a little bit more about our online services towards the end of the presentation, but for now I'm going to quickly change gears and move into family benefits. Now, Social Security can pay benefits to certain spouses, divorced spouses, widows and widowers, which we refer to as survivor benefits, as well as minor and disabled children. So I'm going to touch upon each of these types of benefits and talk about the eligibility factors that must be met to qualify for these payments. Next slide. Okay, so to qualify for benefits as a spouse, the spouse must be at least 62 years of age, which you may recall is the same age requirement for retirement benefits. Additionally, the spouse and worker must have been married for at least 1 year, and the spouse benefits are not payable until the worker collects. So the worker must have filed for and currently receives retirement benefits on their own record. Another factor is the spouse must either not be insured for a benefit based on their own earnings record, or their benefit amount, if they are insured, cannot exceed more than half of the worker's benefit amount at FRA. So, for example, if the worker's FRA amount is $2,000, their spouse's FRA amount cannot exceed $1,000. If it exceeds 50% of the worker's FRA amount, then there's no eligibility for a spousal benefit. And benefits can also be payable to a spouse if they are caring for the worker's child, and that child is either under the age of 16 or disabled. In that circumstance, there is no age requirement for a spouse that has a child in care. Next slide. So requirements for a divorced spouse do vary slightly. Now, a divorced spouse must be a minimum age of 62. However, they had to have been married to the worker for at least 10 years. so the duration of marriage requirement is different from a married spouse. Additionally, a divorced spouse cannot be remarried, and the worker must be at least 62 years old. Another noted difference for a divorced spouse to qualify is that the worker does not have to be collecting their benefits. So in a situation where both parties are married, the worker has to be receiving their own benefit. In a divorce situation, it doesn't matter if the worker is receiving their benefit or not, as long as the divorced spouse meets all of the other eligibility factors. Next slide. Now, for an individual who's eligible for both retirement benefits based on their earnings record as well as a spouse benefit, they must file for their own retirement benefit prior to electing a spousal benefit. So the maximum that they can receive is 50% of the worker's benefit at FRA. So for example, again, the worker's benefit is $2,000 at their FRA. The spouse can only receive a maximum of 50% of that amount, or $1,000. And additionally, the spouse's age determines the percentage of the benefit paid. So just as someone can elect a reduced retirement benefit for filing before their FRA, a spouse can do the same thing, where they receive approximately 30 to 35% of the benefit should they elect the spouse benefit at age 62. Next slide. Now, there are some notable differences in the requirements and the payment amounts for spouse benefits versus survivor benefits. So first, we discussed how a spouse has to be at least age 62 to be eligible. A survivor only has to be age 60 to file. We also have a disabled widow or widower disability program, in which case a beneficiary could file as early as age 50 if they became disabled between the ages of 50 and 60 and are found to be disabled per Social Security's guidelines and rules. And now next, you may notice a difference in the benefit amount a spouse can receive versus a survivor. A survivor taking a benefit at age 60 receives 71.5%, and that amount does increase each month that they wait. And a survivor gets 100% of the worker's benefit amount if they wait until their FRA to apply, where a spouse only gets up to that 50% figure should they wait until their FRA. Next slide. So unlike the spouse rules, widows do not have to apply for their own retirement benefits. So we talked about how a spouse, they have to take their own retirement if they're insured based on their own earnings record, and then they can apply for that additional spouse benefit. A widow or widower do not have to follow those same rules, so they can apply for one or the other. The example on this slide is we have Mary, who was widowed at 63. She could elect a survivor benefit only and defer her retirement benefits potentially all the way up to age 70 if that makes sense for her. We also see people who elect a retirement benefit and they defer the survivor benefit if that's more advantageous for them to do so. So they can kind of select which record they want to file on and which record they want to defer. Next slide. Now, in certain scenarios, Social Security is able to pay benefits to minor or disabled children. However, of course, there are a few requirements that must be met. So that child has to have a parent who's entitled to benefits either due to a disability or a retirement benefit, or if that parent is deceased but worked enough in their lifetime to be insured for Social Security. The child also has to be under age 18, or if they are between 18 and 19 years old and a full-time high school student, they can continue receiving benefits either until they graduate or they reach age 19 and 2 months. And if that child is disabled, if they have a disability that began before age 22 and they're at least 18 years of age, we do have a disabled adult child program where they can continue receiving benefits from that parent's record as long as they remain disabled by Social Security standards. Next slide. Okay, so I'm going to be moving into Medicare. Again, Medicare is the federal health insurance program that Social Security assists you with enrolling through Part A and Part B. So this is just kind of a sample of what the Medicare card looks like. Each person is assigned a unique Medicare number for query and billing purposes, and your month of coverage is also indicated on your card once you are enrolled. Slide. So there's two ways to qualify for Medicare. One is simply based on age 65 attainment, and the other is for disabled individuals who have either been entitled to Social Security disability for 24 months, or for individuals who suffer from kidney failure and receive dialysis, or are due to or have had a kidney transplant. Next slide. So to break down exactly what Part A and Part B cover, Part A is hospitalization coverage. It covers 80% of costs incurred for inpatient visits and stays. Part A is premium free for individuals who are insured for Social Security, so there's no monthly costs associated with it. Part B is medical insurance, which generally covers doctor's visits and outpatient hospital procedures. It also covers 80% of costs incurred for these services. However, the Part B does come with a monthly base premium of $174.70. Some individuals who fall within higher income brackets are subject to paying additional premiums. That's determined on your tax filing status and your adjusted gross income. So if you ever find yourself in that position, I do recommend contacting your local Social Security field office, because in certain situations, we can reduce or eliminate this premium if you have had a life-changing event. Oftentimes, a qualifying life-changing event would be a work stoppage, work reduction, marriage, divorce, or the loss of a spouse. So it's absolutely worth contacting your office to see if you qualify for any type of those life-changing events. Next slide, please. Now, there are 3 different enrollment periods for Part B. At the top, you'll see the initial enrollment period, and that begins 3 months before your 65th birthday, and it ends 3 months after that birthday. So it's a 7-month window that you can enroll upon attainment of age 65. We also have a special enrollment period. That's for people who are 65 or older and are still working and covered under an employer group health plan, either based on their own or their spouse's current work. And then there's the general enrollment period, and that's open every year between January 1st through March 31st. Next slide. So beginning last year, the enrollment periods were streamlined a little bit in an effort to make the process easier and more straightforward. So for individuals who are enrolling in their initial enrollment period, who opt to enroll 3 months ahead of their 65th birthday, their Part B coverage will be effective the first day of the month they turn 65. So if you're turning 65 August 1st, and you enroll for Part B any of those 3 months before that birthday, your Part B coverage will be effective August 1st. If you file in either the month you reach 65 or any of the following 3 months, the Part B is effective the month following the request. So if you turn 65 in August and you request Part B beginning or in the month of August, your coverage will be effective with September. If you request it in September, it'll be effective with October, so on and so forth. Next slide. Enrollment for Part A is fairly straightforward. So for people who already receive Social Security, it's an automatic enrollment. So there's no action or application required for the enrollment. You will receive your Medicare card just ahead of your 65th birthday. And then for people who have not yet filed for Social Security, there is an application that's required, and that can also be filed up to 3 months ahead of your 65th birthday. And the same filing options are available for Medicare enrollment as they are for retirement. So you can file the application online at either ssa.gov or call our national number to make a phone appointment with your local field office. Next slide. Now, when you're enrolling for Part B, there's a few more factors to consider. So if you're not working, not covered under an employer group health plan of your own or your spouse's at 65, you will more than likely need to file for Part B in that initial enrollment period. And again, as the same with Part A, if you already received Social Security benefits, it is an automatic enrollment. Now, for those who are not working, for those who are, I already covered that, I'm sorry. For those who are not working and covered under an employer group health plan, you will want to file in that IEP. Next slide, please. So again, I did cover a lot of this information already, but the initial enrollment period is a 7-month window. It begins 3 months ahead of your 65th birthday and ends 3 months after that birthday. You can go to the next slide. I think we covered most of this information. So should you miss your initial enrollment period, all is not lost. You can file in the general enrollment period, which is open between January 1st through March 31st of each year, with Part B effective the month after you file. So if you contact us in February of the general enrollment period, your coverage will be effective with March. Now, penalties can apply in certain situations should you miss your initial enrollment period. There's a 10% penalty assessed for every 12 months that someone should have had that Part B coverage but did not. And that penalty is imposed for your lifetime. So it's very important to file in the correct enrollment period and know which one is going to pertain to your situation. Next slide. So people who are still working at 65 and have an employer group health plan can generally delay filing for Part B as long as they remain actively employed. Now, once you or your spouse, if you're covered under a spouse's employer group health plan, stop working, at that point you have an 8-month window to enroll for Part B without being penalized. And this is what is called the special enrollment period. Now, you'll see at the bottom of the screen here, COBRA and retiree coverage is not considered an employer group health plan. So often we have people coming in who are, retired city workers, and they receive 5 years of coverage, of health coverage through the city after they retire, and they come in to pick up Part B. Unfortunately, that is not recognized as an active employer group health plan because we look at the actual retirement date, the separation date from the employer. So that is not seen as an active employer group health plan. In those situations, those people are generally hit with a penalty when they do go to pick up Part B. So the key there to qualify for the special enrollment period is that it has to be active employment. You still have to be considered an employee of the company, not a retiree. And we also don't count COBRA as any type of active employer health coverage either. Just a few good things to know if that should apply to you down the road. Next slide. Okay, so I want to talk about some of our online services really briefly, beginning with My Social Security. It's a very convenient and secure suite of services that are really just designed to put you in control of your personal Social Security information. It can help you manage your benefits when you start receiving them. It can help you plan and prepare and have an idea of what your benefit amount will be before filing as well. And your account really gives you all the information that you need at your convenience without having to call or visit a local office. And this is just a screenshot of the page that you see when either creating or logging into your My SSA account. Next slide. Now, one of the most beneficial features of having a My SSA account is the ability to obtain estimates of what your future benefit will be. It draws directly from your earnings record, so it provides an incredibly accurate estimate of what your retirement benefit will be at various ages. And you can get estimates as long as you have enough credits to be insured, you do not currently receive benefits or have a pending claim, or expect to receive a future pension that's based on work not covered under Social Security taxes, as that can sometimes cause an offset in Social Security benefits. Slide. So for people who receive benefits or currently have Medicare coverage, excuse me, These are a lot of the frequently used and popular online services with having a MySSA account. You can request a replacement Social Security card. Generally, as long as you are a U.S. citizen and you have a valid unexpired photo ID, you can do it all online now without having to go into an office. You can also get the benefit verification letter as proof that you receive benefits. Sometimes third parties, organizations, and agencies ask for that type of information, so it's really easy to just access right online. You can also check your benefit and payment information. You can check your earnings record, which is a really great thing to do for accuracy. You can change your address and phone number, start or change direct deposit of your benefit payment, request a replacement Medicare card. If you need a replacement 1099 or 1042S for tax season, that can all be done online. You can also opt out of mailed notices as well, where any notice that we would just mail to your home address would be sent to you via email. Next slide. And for people who do not yet receive benefits, there's still a lot of great features that they can access. So as I was saying earlier, you can view retirement benefit estimates at different ages or dates when you want to start receiving benefits to help you plan for when you want to file. If you are eligible for spousal benefit, you can view potential spouse benefits. You can also request a replacement Social Security card online, whether you receive a Social Security benefit or not. You can check the status of your application or appeal if you have one pending. You can also receive a verification letter as proof that you do not receive benefits from our agency if that is being requested of you. And you can also get your Social Security statement to review. That provides estimates of future retirement, disability survivor benefits. You can check your earnings to verify the amounts that we posted are correct. And you can see the total Social Security and Medicare taxes that you paid over your lifetime. And it's really important to review that statement. On the next slide, I think I actually have a screenshot of the sample statement that's available online now. Years ago, they were mailed out on an annual basis, but that's been scaled back to, I think, about every 5 years now. It saves the agency a lot of resources. It's also kind of a good incentive to encourage people to go online to review it. But the statement shows how much an individual earned each year that they worked, as well as how much total taxes they've paid into Social Security and Medicare. It's extremely important to review your earnings record for accuracy because this will directly impact your benefit amount, whether your benefit is retirement or disability. So if you should see any years missing where you worked and paid into the FICA tax, you can contact your local field office to learn about how to have it corrected, because we can oftentimes do that. Even if you don't have your tax return or W-2 for that year, we can sometimes go to the IRS to see if they have proof of those earnings to give you credit for the taxes that you paid into FICA. Next slide. And you can find us on a lot of different social media platforms. Our handle is @SocialSecurity. It's a really quick and easy way to stay informed about important updates such as cost of living adjustments. Those are usually announced around October or November, changes to the work limits, and our agency initiatives. And we also have a YouTube channel that contains a lot of informative videos about our benefits and services, as well as how to protect yourself and others from Social Security related scams and fraud as we continue to see those on the rise. So it's a really great resource to stay updated and share information with others as well. So that concludes the presentation for today. I want to thank everyone for your time and your interest in our programs and services, and I hope you found this information helpful and informative. I'd like to turn it back to Andrea. I don't know if we have time for questions or if you wanted to take a few minutes to talk before we move into that portion, Andrea.
Yeah, we'll move it to the end. I just want to, well, thank you, Jessica, for sharing all that important information on retirement benefits. I'm just going to quickly cover an overview of how our office, Senator Casey's office, may be of assistance to our constituents regarding Social Security issues and navigating federal agencies. Go to the next slide. Thank you. So Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing an issue with a federal agency. So this includes Social Security benefits, a missing passport, an IRS problem, a VA benefit issue, immigration snags, an SBA concern, and much more. It's important to note that if we cannot provide assistance, such as with a state or a private entity, we can refer constituents to someone who can best help. With regards to Social Security, we can assist constituents navigate the different programs within Social Security Administration, such as Social Security Retirement, Spousal Survivor Benefits, Social Security Disability, Supplemental Security Income, and Medicare Parts A and B enrollment. The most common Social Security cases include Social Security Disability appeals or back pay, a replacement Social Security card, questions regarding the status of a retirement claim, an overpayment, and Medicare enrollment questions. Our office is also able to reach out to Centers for Medicare and Medicaid Service, also called CMS, when it comes to Medicare coverage issues and Medicare Advantage, also known as Part C, and Medicare Part D prescription drug plan issues. A common casework with CMS includes issues with claims payments, coordination of benefits, Medicare as a secondary payer, issues with Medicare enrollment, and coverage of medical equipment, home health, hospital, and hospice care. Go to the next slide. So if you or someone you know needs assistance from our office, you can contact us and we can try to assist you. Our office, you can call us. Our number is 717-231-7540 and you select option 2. Our toll-free number is 866-461-9159, and you can also reach out to us via Senator Casey's website. So we are now we'll go into our Q&A session. So down at the right-hand corner of your screen, there's a little button that says Q&A. You're welcome to click on that and type your question. And Jessica, we do have one question already. They ask, if someone moves that is on disability, how will that affect their payments and how do they transfer that information to their new state?
I'm sorry, the question was if someone moves and they're currently receiving Social Security disability, how does that affect it?
I believe so, yes.
Okay. Generally, because we're a federal agency, if you move somewhere, it doesn't affect your entitlement to the benefit itself, but you do want to make sure that you update your information so that we have, your current contact information. So you want to update your change of address, which can be done online if you have a My Social Security account. If you do not, you can call our 1-800 number or your local field office, and we can update that information over the phone with you just to make sure that we have your current mailing, residence, addresses, and phone number.
Someone else also asked, is that the same for someone on retirement?
It is, yep. So it does not affect or impact your eligibility for the retirement benefit, but we always want to make sure that we have your current information should we need to reach out to you, or simply just for our annual updates. We send letters out to all of our beneficiaries letting them know the cost of living increase every year, if there's been a change in the Medicare benefit amount, the Medicare premiums. We always send letters out to our beneficiaries to inform them of that information. So it's very important to make sure that we always have your up-to-date contact information on our record.
Thank you, Jessica. We'll just give people a minute to type up any other questions that they might have. Alrighty, we have another question. Is someone's Medicare Part B increased this year due to selling a property, uh, which was one of the 2022 taxes, would be something that could be appealed?
So generally, when it comes to properties, it's the loss of an income-producing property that's considered a life-changing event, and a lot of times that could be due to natural disasters. So I can't say for sure without knowing the exact details of the situation, but I would still recommend contacting your local field office to discuss that with the representative if that is the situation. If you can always file an appeal on a decision. So if you did already submit a request for us to look at a different tax year because of that reason, and that request was not granted, you can submit an appeal. You generally have 60 days to file the appeal from the date you receive the letter of the decision.
Thank you. Another question we have is, would you receive benefits if you changed your residency to a different country?
Yes, generally that does not have any impact on your eligibility for the payment. Again, same as earlier, you just want to make sure that you update that information with our agency so that if we do need to send a letter to you to get in touch with you to notify you about any changes or updates with the agency or with your benefits, that we have your contact information. Generally, though, we do continue paying benefits to the vast majority of countries throughout the world.
And one other question is, I received an email stating you now have to create a login.gov or ID me account. Is that true?
That is. So that was just announced last week that we are migrating all of the My Social Security logins to having a login.gov or ID me account. So that was not scam. That wasn't a scammer trying to get your information. That is correct and legitimate. So they are slowly trying to migrate everyone into creating one of those two accounts just for an added layer of protection when logging into the My Social Security account.
Alrighty, great. Well, that looks like all the questions we have today. If you think of a question after the webinar, you're more than welcome to call Senator Casey's office and we can get you an answer to your question. But again, thank you, Jessica, for joining us today. Thank you to our attendees for attending and for asking some really great questions. We hope you all have a wonderful rest of your day.
Thank you.